name is Tina Haynes. I'm the CEO at Claiborne Memorial Medical Center. I have Dr. Scott Haynes with me here today, and we're going to talk a little bit about the coronavirus and COVID-19 and hopefully give you a little bit of information. So, Dr. Scott, what are the signs and symptoms and complications of the coronavirus?
The primary symptoms that we're concerned with are going to be fever, cough, and shortness of breath. Complications would be pneumonia, worsening shortness of breath, and potentially respiratory failure that would happen on or about day 8 or 9. Most people will have a rather mild to moderate illness course, about 80%, where they feel bad, they cough, they have fever, they may have a headache or myalgia similar to the flu, but they will recover without any significant problems. About 15% of patients, however, will develop significant shortness of breath and require hospitalization and treatment with oxygen. And approximately 5% of patients will require treatment in the ICU. And of those patients who require ICU treatment, a significant portion of those will have respiratory failure and require mechanical ventilator.
Okay, we're getting a lot of questions from people about how do they know when they need to go to the doctor or come to the emergency room?
That's a very good question. From the beginning of this pandemic, we have encouraged patients who develop an illness, fever and cough, to go home and isolate themselves from the rest of the community, even their family, for 2 weeks. Those that need to come and be seen at the hospital are those who develop significant shortness of breath. So we don't want you to come and expose anybody to even be tested if you just have fever and cough. There's a real potential that we're going to run out of personal protective equipment. We refer to that as PPE. So we don't even want to expose the healthcare workers unnecessarily for those who may well have mild disease. We want those people to go home and stay home and separate themselves from their family members in their home and not come to the hospital unless they develop significant shortness of breath. And before you come to the hospital, we want you to call so we can be prepared. So that's the most important thing that we need to stress, is that if you are ill with respiratory symptoms such as cough and fever, go home, stay home, isolate yourself from your family, and the time to seek medical treatment is if you develop significant shortness of breath.
Okay. And we're hearing a lot about the numbers in the state and how many cases are in the state of Louisiana. What do you see as the impact to Louisiana and then our part of the state as a whole?
Louisiana as a whole has a significantly increased number than its surrounding states. We have in excess of 200 cases, the majority of which are clustered in the immediate New Orleans area. And luckily, the burden of active cases is very low in our area. We don't have any confirmed cases in our surrounding parishes. The closest is Bossier, which has 1, and Caddo that has 5. That's subject to change because there's a significant backlog in the time that these specimens are able to be tested and reported. But for the immediate time, our area has a very low burden of illness with no active cases in the surrounding parishes.
Okay, we've heard a lot about social distancing in the news. Can you explain what that is and why that's so important right now?
Certainly. Social distancing is the process of avoiding situations where you're with a large group of people. So we've seen progressively, the government initially said no events with 200 people. Then they've said no events with 50 people. Then there have been other recommendations to to no events with more than 10 people. So what we're hoping to do is that by social distancing, we're hoping to accomplish what epidemiologists and people who study pandemics call flattening the curve. So we have a finite capacity to care for ill patients. And if we have a surge that creates a peak of patients, we will outstrip our ability to care for these patients, and we'll see the mortality rate increase from the 2.5 to 3%, and it'll skyrocket because we're no longer able to care for sick patients. We just don't have the capacity. On the other hand, by distancing ourselves from others and practicing social distancing, what we hope to see is that instead of a rapid peak of cases, what we'll accomplish what we call flattening the curve. So we may have a similar number of cases, but we'll have a slower upstroke, a lower peak, and it'll spread out over time, and that will allow the healthcare system to not be overwhelmed. We may treat the same number of cases, but patients who are ill early on will have a time to have gotten over the worst, be off the ventilator, and we'll have that capacity to treat patients who may become exposed and ill later on. So it's of the utmost importance to practice social distancing and to avoid this potential spike of cases that would overwhelm the medical community's ability to care for patients, and we would be in a situation where we would have to choose who would receive treatment and who wouldn't. And frankly, that's a terrible situation to be in.
And so how long can we expect this period of isolation to last, do you think?
You know, that's a hard question to answer, but if you look at what's going on in China, the first cases were documented at the end of December, and you know, we're at in the middle of March now, and although their number of cases, their new cases are declining, it's still active there. So I would anticipate that these restrictions could go on for as much as 2 or 3 months.
Okay. And then we've talked about testing, and so what does being tested for the coronavirus involve, and then how long do you think, we don't know yet because we haven't received any test results back, but how long approximately till you get test results back?
Testing involves obtaining a sample from the nose or nasopharynx on a swab and putting the swab in a viral culture media and sending it to a local laboratory or the state. So there are 2 private laboratories, LabCorp and Quest, which are performing the initial testing. And then there's also the state lab. And unfortunately, what we've seen is we've not run into a situation where we have a shortage of swabs or culture media to be able to obtain tests, but what we've run into is prolonged turnaround time because we're overwhelmed. And that goes back into, and sometimes this turnaround may be 3 or 4 days even. Once someone has a positive test, either with the state or one of these private laboratories, they're what's called a presumptive positive. And to become a known positive, a second test will be run by the CDC. So, and that goes back into the system is already overloaded, and we don't have any desire. It would be nice to test everybody that had symptoms so we could know the burden of the illness in our area, but we don't have the capacity, and the system's already log jammed, so we don't really need to test these people who have mild disease and are going to recover. So we won't, again, really, that's the main point of all this, is to really stress going home and staying home if you have fever and cough, and presenting for further testing and perhaps treatment if you have shortness of breath.
Okay, and we've addressed this a lot, but one more time, especially for our elderly patients and those that are most vulnerable, how do they protect themselves from this?
Well, it cannot be overstated the danger of this illness to elderly patients in our population. If you look at the numbers overall, we're hoping for a mortality rate that stays around 2.5% or 3%, perhaps 2%. But this illness is particularly harmful to the elderly. For patients who are over 70 years old or in their 70s, then their mortality approaches 10%. And for patients who are in their 80s, the mortality approaches 15%. So that's a particularly vulnerable population. The other thing is that people who have chronic illnesses such as high blood pressure, diabetes, heart disease, chronic lung disease, or kidney disease are at an increased risk as well. So they're particularly vulnerable. But the elderly, you simply can't overstate the importance of social distancing for elderly. One thing about this particular virus is that kids and young people tend to not be as severely affected. So they, and this may lead to some idea that, what's the big deal? I'm young, I'm going to be okay. But what they need to be thinking about is their parents who may have diabetes, hypertension, heart disease, their grandparents who are in their 70s or 80s. So this is a consideration where we have to be particularly mindful of our elders and those who have chronic illnesses.
And here at Claiborne Memorial, we're putting in a lot of protocols now to protect our patients, to protect our staff, and those seem to be working. We're working with every CDC guideline and staying on top of that, and you're helping us stay on top of that.
That's right. Lee Jones in infection control has done a tremendous job from very early in the pandemic, and with instituting a policy to sharply limit visitors and screen people as they enter our hospital. It's been a great success, and I've been very excited to hear that the public has really tolerated this very well. There's been practically no trouble. So I think that people understand the threat that we're facing, and they're doing things that they've never been asked to before, and they're realizing that it's for the good of our entire public. So I think Homer Hospital or Claiborne Memorial Medical Center was well ahead of the curve in establishing protocols to keep our community safe.
I think we've had one question that's been asked while we've been talking, and it was, have we tested for any COVID-19 cases in Claiborne Parish?
We have had a handful of cases that have been tested, and there are no positives thus far, and so we're hopeful that that's going to continue, and we'll update the parish and the public in a timely manner. But we're hopeful that all the virus that have been tested so far will remain negative, and we don't have any terribly strong candidates, but we have some people that we're concerned about that have been tested and they're isolated at home. We have no hospitalizations for COVID-19, nor have we transferred anybody with severe illness that may be related to COVID-19.
Well, thank you, Dr. Scott, for being here with us this afternoon and for all you're doing to help keep us safe. And thank you to the community for all that you're doing to follow the guidelines that have been put in place and to be part of the success of what our community's doing so far. Thank you.